Hi, good evening, everyone, and thank you so much for joining us tonight. Our webinar, Fall Prevention Strategies, is sponsored by St. Monica's Senior Living and Arise Physical Therapy. My name is Catherine Harris. I'm the marketing manager here at St. Monica's. This is a nonprofit assisted living and memory care with strong roots here in Racine for the past 50 years. Our community provides a secure, home-like environment for seniors of any heritage or faith in a compassionate Christian community located on 42 acres of beautiful grounds. Our home was founded by the Sisters of St. Rita and is managed by a local volunteer board of directors. St. Monica's proudly holds the 2021 titles of Best Assisted Living, Best Memory Care, and Best Senior Care Services in Racine County. Our community is home to over 100 residents and employs over 120 workforce heroes. As the person who helps people move into St. Monica's, I find myself talking to families who have loved ones that are falling at home and not sure how to help. So this is kind of why I wanted to have an expert share some techniques and tips with you all tonight. So with that, I'll let Kelly share about Arise Physical Therapy and her knowledge on fall prevention strategies.
Thank you so much, Catherine. Hello to everyone, and thank you for joining tonight. I'm Kelly Bardosy. I'm the physical therapist here at St. Monica's. And for those of you that maybe have not met me before or don't know about our setup here, I just thought I would explain just a small bit about my background and history and how Arise Physical Therapy came to be. So, I have a Bachelor's of Science in Kinesiology from the University of Minnesota and a doctorate in physical therapy from Marquette. And I'm going on about 16 and a half, going on 17 years of working experience. I'm born and raised in Kenosha and really did grow up volunteering at a local nursing home, Brookside Nursing Home, if anyone's familiar with my grandma. So I was thinking back to my childhood, high school years, college years, and all the different experiences that I've had that have really brought me to this point of really my dream job here at St. Monica's. But any opportunity that I've ever encountered where I got to choose what coursework, what volunteer opportunity, what clinical rotation, what job opportunity, what am I going after? It has always for me centered around geriatrics and caring for our seniors. So that has been a lifelong passion of mine, and I am just so blessed and grateful to be here. Arise Physical Therapy, so this clinic, and you can see behind me our gym, or at least part of our gym here, was really created between myself and the administration and board members here at St. Monica's with a common desire and goal to offer something that was in-house, more comprehensive, and just generally more preventative in concept to really truly maximize health and quality of life for the residents here. So the benefits of having our clinic here in the building, so I'm on the lower level near the south entrance of St. Monica's. The benefits here are you have this one person, just me, to contact with any questions, to help you out with communications. I can speak to any of the staff members, the nurses, the aides, the maintenance department, the kitchen staff. If there's any sort of concerns that I can help out with, you have one point person that's handling all of those physical therapy related needs. And I think one of my favorite parts is just the fact that I am physically here. So I'm physically in the building every day. I'm full time. I see everyone all the time. So I know just from interactions, they may not be my actual patient, but I likely know your loved one just off of hallway interactions in the dining room, some of the social events, and I know what their baseline functional level is. I know what their normal looks like. So it's much easier than for me and, likewise for a lot of the other staff members to pick out and notice when any sort of decline is occurring. And obviously, as we age, there's a natural decline to some extent, but to be able to notice that and offer some sort of intervention right away is in their best interest. So I love being here where I can get involved when needed as soon as possible. All right. So moving on to our topic of the evening, fall prevention. Why exactly is this important? I'm sure you'll know some of these points, but I just wanted to rattle off a little bit of what I found even off of the CDC. According to the CDC, falls are the leading cause of fatal and non-fatal injuries for older Americans. They are the most common cause of trauma-related injuries resulting in hospital admissions. And as you can imagine, I mean, before COVID, no one wants to be in the hospital, go to the hospital. But now with the COVID situation, we are trying to avoid hospitalizations and trips to the hospital like our lives depend on it. So we are very, very focused on safety and, again, that preventative mindset. As a statistic, 1 out of 4 of Americans 65 and older will fall every year, again, listed on the CDC website. Just to put into terms of how common this is, and obviously those numbers trend upward the older someone might be, but just one single fall, and maybe you are aware of this yourself, one single fall can instill a fear in you or in your loved one of ever falling again. It's a very traumatic experience and often leads to some sort of injury. But that fear that comes from that initial fall has what we're going to call here a snowball effect. So if you are scared of falling again, you're naturally going to move less, get up less, do less, walk less. You're fearful. And by doing less, you're now enhancing your physical decline. So your muscles are becoming weaker, your balance is becoming poorer. And as you're physically declining, you're now even more likely to fall. So when you do have to get up to go to the bathroom, or you are going to walk to the kitchen or out with a family member, now you're even more fearful, which leads to less activity. And that cycle quickly feeds itself. So what we see off of that physical decline and that snowballing of the fear is then people quickly become more socially isolated, not leaving their homes as much. Here at St. Monica's, not wanting to leave their rooms as much. And then, we'll see some mental health issues, specifically depression type issues set in, and the quality of life really go downhill very quickly. So I did want to note here, I did want to note that falling is really never, ever normal. So there are some natural things that decline as you age. Of course, no one stays at the exact same level of strength with the exact same type of balance that they had when they were younger as they get older. But when someone casually tells me that they've had several falls this year, or over the course of the last few years, they've fallen here, they've fallen there. When something becomes common or happening very frequently, sometimes it loses the urgent or emergent feel that it should have, just because you're experiencing it more often. A fall, unless it's just some random tripping episode or something that really could happen to anybody, slipping on actual ice or tripping over something, but falling due to weakness or falling because of your poor balance, that is not a normal or expected piece of aging. So what we're looking to do then is take some steps, preventative and or just interventions if we have a problem, to see what we can do to decrease the chance and risk of falling, and then thereby decrease our chance of ending up in the hospital. So the steps that we're going to outline tonight include, I just wanted to go over how I would go through some screening steps to have a more objective answer to someone's risk for falling, some environment modification techniques that you could do with your loved one, or that just to explain what I frequently do. And then of course, some physical therapy techniques. Okay, so on to some of the screening tools. This is more just an FYI. I'm not going to go through the nuts and bolts of every single piece, just so that you could understand that there are some tools that I use that give me a more objective answer, typically a number that I can document and have as their baseline. And then we can compare down the road to see if someone really is declining, or what is the better scenario is that with physical therapy, we're seeing those numbers improve in the right direction. And that way, it's not just my observation or my opinion, it's something concrete that we can look at in real time. So just quickly, one very common test is called Timed Up and Go. It's a walking test and it measures your gait speed. So it's a 10-foot walking test from a chair to a certain point. You turn, you walk back, and that is timed. The speed, the gait speed that you have is indicative to your leg strength, to your balance. As you can imagine, the slower someone moves, typically the weaker they are and the harder time they have with walking. The 30-second chair stand test is one of my very favorites. I use with almost everyone. It's simply a leg strength test, but let me tell you, if there's one important piece that I drill into everyone's head here, it is working on leg strength. So it's not rocket science, but you can't improve someone's balance, which is the key to usually preventing falls. You can't improve balance if we're working with very weak legs. So starting with a base of a leg strengthening program is extremely important. And I like to know where we're starting from. So this is a test that you're from a certain height chair, you stand up and you sit down from that chair as many times as you can within 30 seconds. Ideally not using your arms, therefore it's just leg strength. But for most people, they may need to use one or two arms to push off. And if so, I make a note of that. But that is a very functional test. It shows me, again, that transferability to get out of a chair, and we're objectively looking at leg strength. And then lastly, there's a test called Mach 10. There's another one I didn't list here called the Berg Balance Scale. These are exams and tests that are a little bit more comprehensive. For example, in the Mach 10, points are assigned for a variety of things, not just strength and balance, but things such as visual impairments, incontinence, how many prescription medications, cognitive level, pain level, things like that. So there are lots of different tests and screening procedures. I tend to pick ones that apply a little bit more specifically to that person, what would make the most sense. But just wanted to make the point that I am always documenting something objective that we can compare future numbers to. Okay, so then some environment modifications. These are some things that I tend to do when I'm working with someone here at St. Monica's, and things that you could apply with your loved ones, either again in their homes, or if you have someone here at St. Monica's to look in their room and just sort of analyze. So we look at the furniture setup and how things are laid out. Sometimes, just looking at how the room is designed, we might have suggestions for moving a couch here or a chair there, more so to clear out a walkway and have an open space that's going to be nice and easy to use. Should we have a wheelchair or a walker, something like that, that we need to get through without a real tight setup. Also, sometimes looking at the actual furniture. So maybe the layout's okay, but we're looking at the height of the couch or the height of the chair, how soft or worn out some of these furniture pieces may or may not be. Do we need something with firmer armrests, something that maybe doesn't rock, just to maximize the independence, the mobility of your loved one in a safe way. So furniture can be kind of a big one that can help out. And then when we're looking at that layout, we're sometimes also looking at how much is in the room. So how much could be cluttering that room. Now, this is a tricky one for most people. And I am sensitive to this to an extent here, because I do notice, and I have seen over the years being here, that when someone makes the transition of moving from their home to a facility like this, an assisted living facility. Now, mind you, it's lovely, and I can't think of a better place to be should you, be at that phase of life. But it's not your home. It's not the home that you were used to before. You're transitioning to a new home. And that transition sometimes comes with a lot of emotions. And I do feel that sometimes people hold on to more belongings, more items, more furniture, probably out of a sense of comfort to them, and or a sense of stability. And it's a sensitive topic to try to take away items that someone might want in their room. So just being sensitive to that. It is sort of a less is more approach, but we have to be careful that we're honoring everyone's wishes and keeping very important things in their room that they definitely want to keep. Now, lighting is an important piece, obviously, but one tip I have here is we run into some issues sometimes, especially at nighttime, when the lighting is low. Maybe there is a night light, but now we're talking about very dim lighting, and someone has to use the bathroom. I've seen some people that have setups where either their lights might be on a remote, though that sort of technology exists where you could have a button that will turn on a lamp for you, or a voice command. So some of these smart devices and smart outlets allow for voice command activation of lights nowadays. And when I noticed that, I'm thinking, oh my goodness, now we don't have to worry about that person getting up, reaching for a lamp, possibly losing their balance while they're even just trying to get the light on before they even get up. So making sure that there's adequate light, and then possibly thinking outside the box with maybe some more technology-based devices for at least one lamp in the room might be a good tip. Assistive devices. So most people that we work with here at St. Monica's are going to have some sort of assistive device, be it a cane, a hemi walker, a rolling wheeled walker, a four-wheeled walker with a chair, a wheelchair. There's lots of different options, but one thing I'm always looking at is, are we using the proper device? So should this person who's walking with a cane actually be walking with a walker, or vice versa? And then the fit and the general shape of that device. So we can get Medicare coverage for a few things, specifically wheelchairs, if they haven't had a wheelchair issued to them before. I work with a company that comes out and does a custom fitting. It's very important that the brakes work well on the walkers and on the wheelchairs. So just taking an assessment, if this was a hand-me-down device, do we need to look into getting them something newer that works a little bit better for them? And that's something I'm very happy to take a look at for you. Lastly on this list is footwear. So if you're already having issues with walking quality, with balance, but when you get up to walk, you're walking in very worn out slippers that are practically falling off your feet, which I see a lot, that doesn't help the situation, right? So just I frequently try to encourage people to get a more lightweight but very supportive tennis shoe that we can easily slip on and off, or just quickly tie, to offer a more stable base of support. All right. Now, before we get into the physical therapy, I did want to touch base on just some other general health items that I'm frequently looking at. I know the nursing team here frequently looks at, and it's just important to keep in mind as you're looking at a comprehensive approach to how are we preventing falls and maximizing mobility and independence. So vision, and I probably should have put hearing on here as well, but vision and hearing, and making sure that your loved one has had a recent eye exam, an ear exam. Perhaps they need an update on their prescriptions for their glasses, moving on to hearing aids if need be. Just making sure that their eyesight and hearing are as good as can be, even though there might be some problems, to help your loved one be as oriented and safe as possible. Pain tends to be on occasion a very limiting factor in the world of physical therapy. Typically, people will have some pain with movement, myself included. So, some aches and pains, a bad hip, a bad knee, some back pain, what have you. My general kind of motto and words of wisdom for people are, if you're going to have probably some pain, right? So if you have some baseline pain with movement, and it's going to be there perhaps no matter what you do due to aging or arthritis, do we want you to be with that pain, but to let that pain also limit how much you move and thereby allow you to get weaker quicker as you age? Or are we going to have that same amount of pain, but sort of work through it a little bit to have an appropriate level exercise program for you to keep your strength and your mobility at a good, appropriate level? So if the pain, let's just say, would be there either way, of course, it makes more sense to maintain your strength and maintain your mobility. But that takes conscious effort and decision-making and saying, well, I know my knees kind of give me some grief, but it's worth it to keep my legs moving. And a lot of times moving helps. We do a lot of low impact exercise, even some non-weight bearing programs that help the pain. And I do some stretching, I offer some massage techniques, things that can actually really help the pain. So pain for me, unless it's extremely severe, is not a firm stop. It's something I like to work through with people and something I like to help with people. The next two items, nutrition and hydration, are very important. I frequently hear from a lot of our residents, family members here, that their loved one is not drinking enough water. And I think that's a universal problem. And to encourage the water intake, the hydration is very important. Sometimes doing perhaps a Crystal Light powder mix in the water or something to make it a little bit more appetizing for them, but also looking at their nutrition. How much are they eating? Are they getting enough food? Are their macros balanced out in terms of their carbs and their proteins and their fats? Are they getting enough nutrients, fresh fruits and vegetables? Anything that you could perhaps supplement in their room to, favorite things that they like to eat that would be healthy and give them good energy. These things are so basic, how you're eating and how you're drinking, but they make the biggest difference in terms of energy level and someone's willingness to participate with exercise or therapy. So the next item I have listed here is memory. Now that's sort of a tricky one because it's a very broad spectrum in terms of memory issues that people could potentially have as they are aging. But from very mild to perhaps more severe memory problems, our tips and techniques for dealing with that in the therapy realm differ. But in general, I'm looking at, is their care level, their supervision level appropriate? Do we need to encourage some other tips and techniques to increase their safety? And there are a few things out there that, again, are very patient and resident specific, but it's something that I'm always looking at because, again, fall prevention is all about safety. And if you're having a hard time remembering this or that, we need some techniques. So there's a few things out there that, depending on your loved one's abilities, that I would be suggesting. And then medications. Now, a lot of people that live here have their medications managed by the nurses at St. Monica's, which is fabulous. But if not, making sure that you have a primary care physician or a doctor involved that is overseeing everything, because I know a lot of times people have perhaps specialists like a cardiologist or a neurologist, then their primary doctor, all of whom may be prescribing different things, and sometimes things go through different pharmacies. So just making sure that at some point there's one person, if it's our staff here, then that's wonderful. If not, that there's at least one person, one doctor or nurse that is managing every single thing that your loved one is taking, supplements included. All right, so now we're on to what is obviously the most important part here, physical therapy. So as the physical therapist of the building here, this is again a broad spectrum because it's very patient specific, resident specific, but in a nutshell, just like I mentioned with how we came to form this clinic, one of our key points is preventative therapy. So early intervention is very key. And by that, I mean, I rely on communication with the staff in the building here, along with my own observations, like I mentioned, of just noticing people, how they're moving, how they're doing. But I get quite a few tips from activities department, caregivers on this floor, nurses, of course, the housekeeping staff will tell me this or that. Everyone is on the lookout here for all of the residents' well-being, which is why I love it here so much. But that gives me then that very early insight to there may be a problem. There may be something brewing with so-and-so. And so, boom, I'm going to go see them today and go see what's going on. Or God forbid there was an actual problem. Someone fell last night. Okay, I'm there. We're going to go look what happened, read up on the fall report, go into the room, assess their injuries if there are any, and immediately formulate a plan. So the point is that we're not waiting for things to spiral out of control, and we're ideally not even waiting for a problem to arise. We're trying to get everyone going to their best level as much as possible and as soon as possible. I do set some fairly high expectations for people, reasonable but high expectations. So we're trying to maximize their independence and their safety, but gone are the days of sitting in a chair and doing leg kicks or some smaller level exercise for someone, or just exercise to exercise. That's not a bad thing, but we are usually typically after a very specific goal or several goals for that person. And we set fairly high goals, high expectations. So in terms of patient-specific goals, this really is the hallmark of what we're doing here at Arise and St. Monica's. But as an example, the physical therapy that I'm doing with people is centered around what they need to get better at. And that is different for every person. As an example, just today, someone told me, I want to be able to get out of bed at nighttime on my own and go to the bathroom by myself. That may be something that you can do easily without even thinking about it. But if you've lost that ability and you were just not too long ago able to do it, but now it's become difficult to do, that is a very big deal. That is a loss of independence. That's a loss of privacy. And it's a loss of some of your feeling of safety as well. If you feel unsafe doing it, that's why you're not doing it. That's why you need help right now. So that person's physical therapy exercises, things that we're practicing on repeat, are going to look a lot like, how do you roll out of bed and sit up? How do you stand up from the height of your actual bed and have the leg strength to do that well? How do you navigate the space in your actual room into your bathroom safely? How do we regain the balance required to get you to walk that distance? And how do you navigate in your bathroom? So most of our actual treatments are going to happen down here in the gym using some of our equipment. But what's nice about being in-house is then we can go and apply it right in the room. So we can practice that very thing. Someone else might have a goal of being able to walk the distance of their room to the dining room. They don't want to take a wheelchair, and that's maybe what they got pushed into, when they first got here, because not many people are used to walking the distance of this building. So if you're coming from your house, this is like walking a mall, so this is a much longer distance to walk. And if you're not used to that type of walking, we have to build into the endurance of being able to tolerate it. So that person's therapy might look more like building endurance for longer stretches of standing activity, longer stretches of walking, until we can actually go from their room to the dining room and back. and then we can allow that person to start doing it in their day-to-day. So the point is, all of our goals, all of our treatment plans are centered around real things that your loved one wants to get better at, wants to feel safer doing. And then my treatment plan and my exercise programs are as functional as possible. And that all the exercises, you can almost just see exactly how they flow into those very movements, but they're all designed to flow and assist with regaining that functional mobility. The actual exercise programs, like the actual things that we do, obviously vary based upon baseline balance abilities, strength abilities. So where you're starting from is where we're starting from, and then we're building from there. No matter how low of a level that may be, it does not matter. We can build off of that. And key areas that we're typically working on with just about everyone would be leg strengthening, also arm strengthening to some extent, but the legs obviously are what we're going to need for the walking and the mobility. So a lot of leg strengthening exercises, weight shifting exercises, which is, to me, the nuts and bolts of balance exercises, meaning how you shift from right to left, how you shift if you reach up or you reach down, diagonal movements, things like that. A lot of times people will have decent balance if they're just in their center. Their weight is right over their feet. But God forbid they reach for something in a cupboard or in their closet or to turn the light on. If their weight shifts outside of their center of gravity, that's when they lose their balance. So a lot of my exercises focus on sitting, but mainly standing, weight shifting, and practicing, which flows right into core stabilization, utilizing and strengthening the core muscles. All these things go hand in hand. All right, and then just as, we're not going to do this as a group, but just as a few examples, so you're thinking, okay, so what exactly are you going to do with my parent? Again, it would depend on where we're starting from, what their baseline level is. But as a brief example, these are exercises I frequently do with people. And you can modify a lot of these to be in a sitting position, but sitting or standing, we're doing a diagonal reach motion where you might be reaching up to the right and down to the left and vice versa. Sometimes with, reaching for an object. We're doing a lot of forward weight shifting. So coming forward in a chair, forward and backward, and then arms, if you have armrests on the chair, boosting up to actually stand up, almost like a push-up motion with your arms. That's an important arm strengthening motion for me because that pushing motion is one of the initial pieces of standing up. Sit to stand is on repeat. So as many times as we're able to do, and that number is something I track real regularly, but building up the strength and the endurance to sit, stand, and keep going, and knowing your number. I can do that only one time and I'm pooped. I can do that 5 times and now I'm doing that every day 5 times and now I'm shooting to get up to 10 times. Knowing a quick exercise that gives you a lot of bang for your buck, but that you know what to do and where your normal is and what your goal might be, that's the ideal exercise for me when I give someone something to practice at home. Then we do a variety typically of with people that can tolerate standing positions, standing marches, leg lifts, reaching, rotating and reaching to the side. And for those that are a little bit more advanced with balance, possibilities are endless here, but we do like a square stepping routine. Some people will do single leg balancing. I use some equipment here in the gym, but I have some foam pads and different surfaces we can stand on to make the surface a little bit more wobbly. And I utilize a balloon or some of the balls in the back there, beach balls and some of our Swiss balls to work on catching, reaching, tapping, and tossing. Those are things where the ball or the balloon almost tricks you into doing some of the exercises because you're just thinking about hitting the ball, but you've activated a lot of muscles to do that. So, and it makes it more fun. So let's see here. Before we get into any questions, which I will open up in just a second here, I just wanted to kind of summarize real quick. And just say that obviously I'm a physical therapist, so I'm very focused on physical health and physical mobility and working on strengthening and things like that. But my ultimate goal is that your loved one's quality of life is as good as it can possibly be. And I feel that that is greatly dependent on their emotional and mental health as well. So I think that what I offer here is a connection, a friendship, a relationship that they can have with someone in the building that they know cares about them, and that I'm drawing them out of their room. We're working on very important physical things to get them better physically. But I've seen this so many times, just the fact of leaving your room, coming down to the gym, having a change of scenery. We'll put our Alexa on and listen to your favorite music. Oftentimes someone else will come into the gym to do some exercise. So there's a little bit of social interaction and friendship there. We start to see that snowball effect happening in the right direction, which is things are improving. People are more social, just generally happier. They physically are feeling better, but they're more mentally and emotionally feeling better as well. And that really is my ultimate goal, is that when you call to talk to your parent or your loved one and you say, how are you doing? That they are going to say they're doing good and that they're feeling good. And that has so much more to do than just, is their knee fixed? So I'm really trying to keep an eye on that for them and encourage different friendships and different interactions for people. But I thank you so much for your time and for listening tonight. And please do not hesitate to call me. My phone number is here. I have a website, arisephysicaltherapy.org. And then feel free also to email me, kelly.bardosy@arisephysicaltherapy.org with any questions. If you'd like me to check in, do an assessment on anyone, one of your loved ones here, please reach out. Thank you so much.
Thank you so much for all your information. It does look like we have a couple of questions.
Oh, okay.
So let me read those to you and you can share your wisdom.
Okay.
Here. So I have a question from Stephanie, and she says, what if my dad's memory loss will keep him from remembering what you taught? So like, can he still benefit from physical therapy if he has memory loss?
Okay, so that is, like I say, the memory issues, depending on the level of severity, can be a limiting factor. However, what I tend to do is we sort of minimize the number of things that we're focused on. So I try to keep it very simplistic and very focused on the most important items that we want to improve with someone. So if we're looking at trying to get someone to transfer and move independently out of their wheelchair or their chair, we're going to have one or two key exercises that we're going to do repetitively and then practice repetitively in their room in the very chair that they want to get out of more independently. And a lot of times what will have then happen is that we develop some muscle memory. So when your loved one sees the area that we've been practicing on, they start to develop that muscle memory of where their hands go, how to shift forward, or whatever it is we've been working on. That because of how much we've simplified but repeated the practice, that I will see some carryover. And then other little things that I will do, or that I find very important, are just to write everything out. I'll post it like on their wall or wherever it would be most visible. Some very clear and simple instructions, pictures of the exercises that we're practicing, so they don't have to just remember, what I'm saying. And then again, that's the nice part of me being in the building, is that I'm here to follow up and to sort of encourage people to keep, okay, are you remembering to do this or that? Do you want me to help you? This type of thing. And lastly, if we're dealing with something that might be a little bit more severe in terms of memory problems, and we're concerned about safety and because of memory, then I encourage the staff to keep the door open to that room if that's all right with your loved one. We encourage that person to come out into the common spaces more, to keep, more eyes on them, just to make sure that they're as safe as possible, and that they participate in as many activities as they're able to, again, for more supervised time.
Great. Another question would be, what are some other things do you have any techniques that, this is a funny question. So it sounds like this person has a loved one who is a little bit stubborn. So do you have like techniques or suggestions as to how you might help someone who maybe doesn't really want to work with you?
Oh yeah, well, let me tell you, that's a lot of people sometimes, a lot of people in this category, but in a good way. I mean, I hear that a lot from people. Oh, my mom or dad is very stubborn, or they're not going to follow your advice, or they're not going to participate. So I'm well versed in handling that type of situation. I can't say I have a 100% success rate, but I am very persuasive. And I really do think that building a relationship with them where they enjoy spending time with me and that they trust me is key. So I don't know. I'm not a fan of the concept of sort of force feeding the therapy. Like, oh, I'm here, we're doing this, we're doing that. Especially when we have a personality such, that might really say, no, get out of my room, or I don't want to participate. This isn't for me. So I just find that I have a lot more success when I'm obviously very respectful of their wishes, and they know I'm not forcing you to do this. I'm going to very clearly talk to you and explain to you what I can offer and how this might help you and help your life, and might help you achieve a goal or two that you actually want. You want this independence and you want this type of privacy, but you can't get it. You can't do it on your own. I can help you get there if you want to. So when I make it a little bit more optional, although that sounds like it might not work, it tends to work, where it's their choice to participate, and sort of take it or leave it. Like, I would love to work with you, but you don't have to do this. And when they know that, okay, well then she's possibly not going to help me if I say no, tends to be that most everyone will say, well, actually, I'm okay with just trying this out. And then I'm in the door. Okay. So then we start to build that relationship. And I really, like I say, I have a pretty high success rate that once I'm in the door, that and they start to come down to the gym with me, that it's a positive experience and they don't hate it. They enjoy it, and that is my goal, is that this shouldn't be a drag. This shouldn't be something that you're dreading when I show up to your room. This is something for your benefit. So I can handle it.
Awesome. I just want to make sure nobody else has any additional questions. You can press the button to raise your hand if you want to do an easier version of, we can turn your mic on and you can ask questions. You can also type that into the chat or the question and answer section there. So I have a question, Kelly. I know that you probably don't work with just people who are fall risks. So what other offerings does Arise Physical Therapy have to help seniors in the community? And this is open to the public, right, Kelly? Like, anyone from the street can come in and be one of your patients and benefit from your services.
Right. So yes, this is an outpatient clinic. So it is open to anyone in the community. I would assume mainly the Racine community, but anyone could come for outpatient therapy here. And I've had some patients come in from the community, and it's fun for me to sort of switch up the diagnoses that we're working with. But even here in St. Monica's, obviously the fall prevention piece is something pretty universal. But I have different things that we're frequently doing with people, such as orthopedic treatments. So it could be that they had their hip replaced, their knee replaced, back issues, either back surgery or back chronic back pain, a lot of rotator cuff problems that we're dealing with to regain the shoulder range of motion and mobility and strength. I do quite a bit of neurological rehab, primarily post-stroke rehab. And then I have a specialty certification in Parkinson's disease rehabilitation. So that's an area that we've had a few people here that have that diagnosis that I've been able to specifically work on. Really, the answer is anything. So I have a lot of my working history is in outpatient orthopedics and in an outpatient clinic. Typically, you see anything you can possibly think of. So I have experience treating just about everything. Our specialty here would be geriatrics and older adult rehabilitation for whatever their diagnosis or condition might be. But I welcome all ages and really any diagnosis.
Awesome. So I just want everybody to know, in the chat box, we did put a link to our Facebook page. So go to Facebook and like Arise Physical Therapy. And if you're rewatching this, not live, it is Arise PT at St. Monica's. That is our call to find us on Facebook. But thank you so much for attending tonight's presentation. And thank you to Kelly for your expertise. This was an amazing presentation. And I know people are going to rewatch it, even if they're not here live with us, and be able to get some really valuable information. But like Kelly said, I think her screen is still up there. Are you still sharing that screen with all your contact information? Yeah, perfect. So you can reach Kelly at that direct line through her website, and then also email there. So thank you so much for attending, and we'll see you on the next one.
Sounds good. Thank you.
Okay.
Bye-bye.